They give me confidence. This is my first child, and I just want the best care for her. Since I'm a first-time mom, you don't know what is normal, what is different. I ask him a lot of questions, and he takes the time to answer them. Once you find a very good doctor, it don't matter that you have to be on the car for an hour.
Esperanza really serves anybody who comes to us, but our primary target population is Latino folks, and about 95% of our patients are Latino. We serve everybody from prenatal care to geriatric care, and we try and make that care as responsive as we can to individuals' needs. Esperanza is a community health center, and we take that title really seriously. So we try and provide programs that can really meet community needs. We provide early childhood literacy programs by prescribing books to kids. We also have an early childhood obesity program where we can work with kids to make sure that they maintain a healthy weight. For people who already have chronic diseases like diabetes, we provide diabetic management classes. We provide cooking classes to talk to people about how to provide healthy food for themselves and for their families. We also provide incredible clinical care. So we're looking really closely at our measures all the time to make sure that we're meeting national standards. And in fact, in the last year, we were really proud that the federal government named us one of the top 5% of all health centers in the country. We offer the same care to people that they might get if they lived in Lincoln Park or if they lived in Evanston. We hire physicians and nurses and other staff members who want to make sure that they're doing that every day, and they struggle to provide equity and full access to the best primary care possible.
For a lot of our patients, they haven't engaged in a lot of medical care, or they've engaged in medical care with providers who don't speak their language or who don't really kind of try to meet them where they are at. I think part of what we do is provide culturally competent care. So whether it's in English or in Spanish, kind of recognizing the cultural experiences that our patients are bringing.
From the moment the patient steps into the clinic, you're always going to see them receiving you with a smile and try to solve that problem there on the spot. The MA is going to come out, is not going to be yelling out their name. Armando already knows who the patient is. All our MAs, all our PSRs are from the area. So many times I know that patients are walking down the street and I recognize Armando and they say, hey, I saw you last time at the grocery store. So that makes them all feel super comfortable again that they will be at home. Many times, likely, I'm also blessed having a patient actually running and giving me a hug as well. I have to do the dirty job in which actually start giving shots, which I'm not very happy about it. But even after receiving the shots and crying, just by giving a sticker and giving a hug, they start smiling all over again. And the next time they come and see you again, they give you another hug, which is beautiful. They know we're doing their best for them. And again, they keep coming back, the same patients, and they're bringing their families, they're bringing their friends.
We know that health is more than just the absence of disease, but it's also the presence of wellness. And we feel that we have to address more than the medical component of a patient. We also need to make sure that they are doing well and have a high quality of life. Our Girls on the Run program is a program for girls ages 8 to 10. It's a national recognized program where they are training for a 5K through a 10-week course. And in that 10 weeks, they're learning about self-esteem, coping skills, how to be a good classmate, how to be a good sibling. And all of that is happening while they're doing physical activity.
One of my patients, Eduardo, he is a superstar patient. When I diagnosed him with diabetes, he already, I think, had an idea based on how he was feeling and kind of his family history. And he just right away made incredible changes to the way he was living. He joined our diabetes group visits program.
Fue una motivación extra cada que era una clase porque volvías un poco a entusiasmarte un poco para volver a iniciar, aunque cayeras un poco o te sintieras mal, te ayudaba mucho. El maratón principalmente es una motivación personal para mí. Por supuesto, con la atención que te dan aquí, el apoyo que me han dado para estar en el maratón, Es fundamental eso para tener salud, el ejercicio.
And he was the rock star of the group. Every time we met, he'd lost a bunch of weight, he was running more miles. He really inspired the entire group of other people working and struggling with their diabetes. And he also inspired me, just kind of in the way he was willing to make significant sacrifice and significant changes for his health. It takes some people years to really accept their diagnosis, and other people, more like Eduardo, they get their diagnosis and they're ready to make changes, and they prove that it is possible to really prevent kind of the negative consequences that can happen.
The philosophy of care here at Esperanza is really to maximize the quality of care that we deliver for our patients. We really try to take it to the next level and focus not just on access, although that's extremely important, but also maximize quality. So when Dan and I meet with a provider that we're considering hiring, we obviously pay attention to important things like where did they go to school, where did they do their residency or their nurse practitioner program, what did they get good grades, etc. But the most important factor for us is, do they play well in the sandbox? We've really taken a team-based approach to primary care, and so it's important that we hire providers who don't view themselves as the only person involved in the patient's care, but who really view themselves as the team leader, the quarterback of the team, if you will. The patient is the center of it all, and we design a team around them to serve them best. So it involves that provider, the medical assistant, the care coordinator, making the entire team available to the patient so they have multiple people that they can reach out to when they need to.
We know that there's a lot of need still in our community and that we're in a good position to help meet that need. And that is going to be one of our primary concerns going forward, making sure that we're available to more and more people.